My name's Jim Sheehan. I live in Alta, Wyoming. I hailed originally from St. Paul, Minnesota, but moved out here in 2019 when I retired. I moved out here because I've got a fairly active lifestyle. I like to hike, bike, ski, and do everything that people do in the Mountain West towns. And now a grandpa of a 2-year-old, and so that also lives here. So I get to play with him and be active there as well. I've been a active individual my whole life, and I didn't have any specific time that I know that I injured my shoulder. But through CrossFit and triathlons and lifting, who knows? Just my left shoulder really started to ache and catch, and just was getting to a point where it was uncomfortable because I sleep on my left side. It was waking me up with a certain amount of pain every night. And I'm not somebody that seeks medical attention. I think I'm like most men. I sort of put it off, and I finally just said I've got to go get seen. So the whole lifting over your head, it was really throughout the day, it would just get more and more sore throughout the day, avoiding that arm and lifting anything. I couldn't reach over my head. I couldn't hold my grandson properly. I think I actually met Dr. Turkula, Stefan, first name basis now, in a coffee shop. He would stop in almost daily, and got to know he and his wife and kids. I consulted with him first, and then we decided, he gave me my range of options. So I opted to get an MRI. And once he sort of looked at that, he was able to identify, I had a tear, and just the comfort level there. He's seen top level athletes and people that make their living by having functioning joints. And, it was very easy to talk to. He didn't push me down the surgical route at all. I sort of pushed myself down that, and he agreed that it would help. And he was very forthcoming with the amount of recovery that I would have to go through. And it just a good person. And I like supporting people that are in our community. I was happy we had a great orthopedic person here. Extraordinary. Like the day I was having my surgery, I was the only person having surgery that day. I knew almost everybody, from my anesthesiologist to the surgeon to the nurse. I knew everybody. And I would say the attention and the care that I received was even more customized. And then after the surgery, we had some great physical therapists. I ended up going with somebody here locally for the physical therapy. Physical therapy went fine. The follow-up appointments were all fine. It is a surgery that I had to really listen to the recommendations. I was told ahead of time how long the recovery would be, and it takes the time, and you have to be careful, and you don't want to re-injure. Plus side, my left shoulder is pain-free. I've got a full range of mobility, and I can do, I do modified lifting. There's certain things that I avoid doing over my head now. Not that I can't do it, I just don't want to re-injure. I'm back to doing my lifting pretty much every other day, still skiing, still biking, still hiking. So I've able to carry on with an active lifestyle. Well, the reason I've recommended him to a number of people is knows what he's doing, and he's a unbelievable surgeon. I would put him up against anybody I ever had work with at the Mayo Clinic. And he's a good person. I've worked with many doctors too that don't have the bedside manner that someone like Dr. Turkula has, and he's just is very patient with you, answered all the questions, and is very approachable. Talk to a professional, MD, a doctor like Dr. Turkula. Ask what your options are, look at those options, and then really think through what you want to approach. And I was always given a range of options. I ultimately chose surgery, and I'm really happy I did, but I was not feeling pushed down that route. And you don't want doctors that push you down certain routes. You want the option and to be able to talk to other people and just see what the experience has been.